Welcome to Aesthetic TV. I'm Dr. Andrew Ordon. And in bringing you the latest and best in medical aesthetics, we here at Aesthetic TV get to work with some of the top physicians in the field. And today we have a fantastic example of someone who really is at the top of their field. My guest today is Dr. Joe Niamtu. Besides being a board-certified surgeon and being recognized as one of the true leaders in the field of facial cosmetic surgery, Dr. Niamtu is also a teacher and author who has written 4 textbooks and has been published hundreds of times. He also regularly lectures around the world and has taught on 6 continents. I guess he's missing one of the continents. On top of all that, now here I got to give full disclosure, he's a friend and a colleague of mine. So welcome, Dr. Niamtu, and thanks for joining us here on Aesthetic TV. It really is a pleasure.
Good to see you, Drew. You know, you're one of my heroes, and I've always wanted to sit down with
shucks.
you. Now listen, you and your show have done so much to promote cosmetic surgery, and you know, not only to surgeons, but you're a patient advocate, and you've really propelled the whole industry.
Well, thank you, Joe, and we've sat down many times before. This is the first time in front of the camera, but I enjoy spending time with you, and
Thank you.
I see a lot of myself in you. You've got a real passion for what you do. You love it. You love your profession, and you love life in general, and I enjoy that.
You know, I'm a lucky guy. A lot of my friends that I graduated with, and I'm sure your situation as well, you know, they can't wait for Friday. They can't wait for retirement. And when people say, you know, thank God it's Friday, I say thank God it's Monday, because I get to go to work and operate on people and make them look and feel better. Well, and I love it.
Well, Joe and I are the same age, and thank goodness to Botox, we have no plan on stopping soon, right?
I wish I had his hair.
But why don't we jump into it? So why don't you start off and tell me something about your practice, and I have some other questions I want to ask you.
I practice in Richmond, Virginia, and my practice is limited to cosmetic facial surgery. And again, I'm just eating up with it. I'm excited. I love to do it. I love to talk about it. And I have a busy surgical practice. My favorite procedure is probably facelifting, and I do several a week.
Me too.
Yeah, I know you do. And I do a lot of eyelid surgery, a lot of facial implants, a lot of laser resurfacing. And I've got a pretty big injectable practice as well.
Mm-hmm. Good stuff. You know, I hate asking this question, but I get asked the same question. Why medicine for you, and why did you specifically get so involved in plastic surgery?
Well, you know, when I was in high school, I observed some doctors in my hometown, and it was a facial trauma case where a little girl got hit by a car, and I was doing a little high school rotation thing, and I watched them repair this facial fracture, and was mesmerized by not only the surgery, but the anesthesia, that this was happening, and I was fascinated from then on.
You know, that's similar start to I had. I know you have a background in oral maxillofacial. I have a background in head neck, and for me it started with facial trauma as well at USC County, and that's sort of, you know, repairing that, fixing somebody after an injury sort of stimulates to go further and improving the quality of life for people. So any other particular procedures that you really love to do, and what would you say is your favorite procedure?
Well, again, my favorite is probably facelifting. I think that's the ultimate rejuvenative procedure. And even when you compare it, first of all, I only do head and neck surgery. So I tell my patients I work from here to here, and I don't do boobs, bellies, and butts, all right? So
that keeps it simple.
So that narrows it. But I think it's the ultimate rejuvenative procedure, because you can hide mediocre breast surgery, you can hide mediocre abdominoplasty, but the face, there's nowhere to run, nowhere to hide.
Such a great point. There's no amount of makeup that's going to cover up things if they're not done right on the face. And you and I had a chance to talk off stage here about your philosophy. I know you really believe in complete, total facial rejuvenation. In other words, addressing lax skin, volume, and resurfacing the fine lines of the face all in one setting.
Well, you know, Drew, I think for years, a facelift is such a stigma, just the word. For years, cosmetic surgeons made people look tighter, but not younger. And, you know, we realize, and all the multi-specialties that are involved in this situation today, we realize that it's so important to put something back and not just take things away. You don't want to take a skeletonized face and just push the skin back. So I do a lot of facial implants, fillers, a lot of laser. It's rare that I do just a facelift.
You know, that's such a great point, Joe, because we're taught it's not what you remove, it's what you leave behind, because that's what that's what's going to show. You know, I mentioned in the opening that you're an author, a teacher, and I know that you love the academic side of our field as well. That's how we've met at these meetings. What else can you tell us about that side of your career?
Well, you know, I think some people, they're just a little bit of teacher in them, you know. And when you go, if you look back through we've done a lot. We went to school the 26th grade or whatever, but there's really maybe 3 or 4 teachers that really stand out, that really instilled a passion in you. And I used to look at those people and say, man, I'd like to do that. Plus, you know, we're all a little bit, see, you get to be a performer, okay?
Well,
so
we both perform in the operating room.
Yeah, but, and I don't know, I like when you learn something, I like to be able to convey that. It excites me. It keeps you young. It keeps you on the cutting edge. And so academics is a big part of my practice.
You know, that it keeps you fresh. If you have to teach, if you show somebody how to do it, that means that you're keeping your skills at a higher skill set. Now, I know you're a surgeon, and like me, you love to cut. We like to operate, but there's also a strong trend for non-invasive, minimally invasive treatments and procedures. So how do you feel about that, and how do you incorporate that in your practice?
Well, you know, I think first of all, Drew, 25, 30 years ago, a surgeon was a surgeon. That's all they did, and it would have probably driven them crazy if they had to do something else. And I tell my staff, you know, there needs to be blood on my gloves. This is what I love doing. But the paradigm shift and the game change of Botox and fillers has made such a big difference. And you know, when you're in the operating room, as you are well aware,
right,
doing a 5-hour case, it's nice to come out there and just do some injections, and you're doing little things, and people love it, and there's no recovery, there's no healing. That excites me. I do think that there is a little bit of trepidation, though, about things are getting so minimally invasive, and people are promoting cosmetic surgery. You know, you can have a facelift, no bandages, you can drive home, don't have to miss work. I think it's a little misrepresentative for the public, and I think that patients have to understand that although as technology progresses, we're going to get tighter on things. For instance, a facelift used to be 4 days in the hospital, and it's not your mother's facelift anymore.
No.
But I tell patients, you get what you pay for, not with money, but with recovery. And if you really, you know, if somebody's our age and they have, you know, a lot of excess neck skin and everything, they're going to need a comprehensive procedure.
They're going to need a full face neck lift.
And, you know, a lot of times people say less is more, but I don't know. In life, it rarely is less more. So I'm pretty much, I'm a more comprehensive surgeon when it comes to that.
Well, and me too. But the great thing about being as a surgeon that we can go as invasive as we want to. We can start with something little and always move on. Now, as a surgeon myself, I know that one of the most fulfilling aspects of the profession is helping others who are less fortunate and can benefit from our skills. And I know that you're also deeply committed to philanthropy. Can you talk a little bit more about what kinds of charitable work you're involved in?
Sure. First of all, I think that, you know, it's a risk of sounding arrogant. I think that all surgeons do have a gift. And when you look in wherever you happen to live, there's only a handful of people that can help somebody with a certain problem. Now, I know you're getting ready to go on a mission trip, which I have to admit, for somebody of your stature to just go and live in the jungle there, that's pretty cool. You know, my parents always just brought me up to always give back to your community. And from the beginning, I've done a lot of pro bono work, and it started out like your career did, mostly with trauma. And then as I transitioned into a fully cosmetic practice, you know, there's a lot of disenfranchised people out there that don't have the availability of care. As you're aware, Drew, I have 2 severely disabled children, and so I become ardently involved in doing work for people with disabilities. So the kind of work that I do, a lot of it has to do with children that are being bullied, where they have protruding ears and we're doing otoplasty, or they have facial scars and I'm lasering. I have a couple patients that have severe burns. One girl had acid thrown on her, a young girl, and we're trying to release her burn scars with a new laser technology. I have a couple, currently a couple cases of domestic violence where patients were severely assaulted or one shot in the face by her husband point blank. So these are people that can't go anywhere else. And you know what? When you walk into a room and somebody's paid you a fee to do a facelift and everything, and you know they're happy, it makes you happy. But when you walk into a room and there's somebody that jumps up and hugs you and kisses you and is crying, there's no warm and fuzzy better than that.
Dr. Niamtu, tell me, what are the trends that you're seeing in plastic and cosmetic surgery?
Well, first of all, when you talk about trends, I hope I can do this for a long time.
Amen.
I mean, you know, I think you're the same way. I'm a cosmetic surgery nerd. I mean, I just love doing this. To answer that question specifically, I think that although a lot of this minimally invasive skin tightening with heat and cold and ultrasound and radio waves, it's in its infancy, I think that is they're gonna perfect this. I think we will be able to tighten skin without cutting it off. I think that, you know, your fillers are gonna last longer, your neurotoxins. I mean, they're going to look back someday and they're going to say they had to inject this in people's face with a needle. I think they're going to find alternate, you know, application routes for that. I think there will always be incisional cosmetic surgery, but you know, Drew, sooner or later they'll probably approach this genetically.
Yeah, we're modifying the aging, the genetic aspect of aging now. So you're probably right there. All right. And for patients out there, how do they find out more about your practice and how do they set up an appointment with you?
All right, I'm going to brag a little bit here, okay? To answer that question, look at lovethatface.com is my website, www.lovethatface.com. And I do this website myself, okay? And I spend a lot of time on it. And again, it boils down to that cosmetic nerdism, you know? And I have, it's chock full. I have 7,000 before and after pictures. I have a lot of videos, a lot of animations, a lot of explanations, and you know, you know the same thing. Seeing a doctor is really different now. Before, you know, traditionally people would look in the yellow pages, they'd call and make an appointment. Today's patients are very sophisticated, and you know, 10 years ago I would have never thought about putting actual live surgery for a patient to see, but now you know you have to be on YouTube. I probably have 100 videos out there, and we're really dealing with a national and sometimes international clientele in a very high level of sophistication.
Dr. Niamtu, a real pleasure. This has been a great interaction. You got me all fired up to go do some surgery, and let's do it again.
I'd love to. It was great sitting down with you. I've always wanted to do this.
Thank you. So again, to find out more about Dr. Niamtu's practice, go to www.lovethatface.com. And until next time, I'm Dr. Andrew Ordon. Thanks for joining us, and remember to stay tuned and stay beautiful.